So I took over the care of a patient in the wound center here who was what we call palliative, meaning that they have a wound that they've had for a long time. And because of multiple factors, things like other medical conditions, nutrition, how old a patient is, whether they have a lot of immobility and can't stay off of a wound, things like that can make it so that the expected chance that a wound will ever heal is pretty minimal. And so you're really trying to manage the symptoms and keep it from getting worse. So I took over the care of this patient knowing that, and I kind of decided, I looked through everything that had happened and said, let's change what we're doing here and let's completely reapproach how we're treating this wound. And to my surprise and everybody else's, her wound actually started responding, and she was able to completely heal it and be discharged from our clinic after having been there for 8 months before I had even taken over. And that happened within a couple months. And she has not come back with a new wound. So, we were able to take that aspect of her, everyday care out of being needed anymore, which, for an elderly patient at the end of life, that's a big deal. It's one less thing for her to have to worry about and for her family to have to worry about. And it was really nice to be able to give that to her and her family.